Well, welcome to this week's episode of The Dental Guys. I'm Wes, the Dental Guy.
And I'm John, the Dental Guy. Wow, Wes. Here we are, man. I mean, give us a little bit of a taste. Give us a taste. Where are we at? Where are we at this week?
We're back! The next level is here, John. Episode 150, right? 2024 is here. What in the world? Wes and John are still friends.
As if it was ever in doubt. My goodness, people.
Are you still my friend, John?
I mean, let me just check my social media feed. Yes, I am. Yes. It
Status update. John and Wes never stop being friends.
It's hilarious. The internet has weaved many interesting stories, and none so interesting in our world as, where are the Dental Guys? What's going on? Did they get in a fist fight? No. Like 2023, 2022, even 2021. I mean, really, can we be honest? Since COVID, life has been crazy. And I mean, I think everyone's felt that. Everyone has felt that, including us. And as you guys know, we have been from the beginning committed to doing the same thing. I mean, it all started with the conversation that Wes and I had about what are you doing in your practice? What's going on? What's challenging you? What are you struggling with? It has never stopped. Nothing has ever stopped that. But I will tell you, man, life hits, right, Wes? I mean, there are certain things we face in our practice lives, in our lives in general, that just make you have to go, what are we going to do here? And Wes, I mean, it's been a crazy few years, man. Like, it's been a crazy few years.
I love it. The next level is here. John and I have so much to talk to you about, right? A little update on, John and I and where we've been and what we've been doing in this episode. We've got some things to talk about coming up, some various special collaborations this year.
Yep.
You're going to love it. It's more the same. We'll get to that in a minute. But we're renewing some old friendships. And so for you guys, we're going to renew the podcast in a big way this year. For John and I, things are more of the same. Some are different. Some things change, and change is hard. But change, for the most part, has been really good. I know that the last time, personally, that I updated you, John, on things on my end, was we were in the midst of completing a building project. I've been in my new facility, 9-operatory practice, new associate this year. Super excited about associateship. We even talked about associateship on our podcast and what that means for you associates out there, and for new dentists. What's that mean? You might want to go back and check out that episode. But for me, being in a new facility, operating business in a different way, John, that's been some things that have been going on. We may get into that this year, and how systems have changed from a small mom and pop's business to something that grows, and how you outgrow old systems, right? That's where change is hard, and that's where people, right, maybe think you change as a business owner. But I'll tell you one thing that's never changed in my practice as a dentist, and personally, is really I am about the next level. I do think about things a little bit differently than I did maybe even 5-6 years ago, 7 years ago when we started this show, The Dental Guys. And we may talk about that and how my thought process have changed. I know, John, you've got some of those same things in your mind. One of the other things, too, personally, seeing how the work-life balance, right? John and I said when we went on this journey, John, we said we're not going to let our podcast, right, take precedence over some of the personal things in life that matter most. And John and I both are we have happy personal lives, and
Yeah.
some and honestly, really, we are never. I mean, we've never been happier. In fact, in some
Yeah.
ways, this is the happiest that John and I have ever been. I mean, I have a beautiful wife, and I'm proud to talk about her. She's been on the show years ago. And John, you've got some exciting things to talk about coming up, about some things going on in your life with your significant person there, and I'm excited
Yeah.
about that. And John, it's again the work-life balance, and I'd love to talk about this even more on the show, and as we've grown personally, right? About how work-life balance is so important. And for you new dentists out there, right? Hey, spread the love about the dental guys. And for you older dentists out there that are looking to rejuvenate your practice, right? That's what we're about, right? We're about starting up, doing it right from the very beginning, getting excited. You can't afford to wait, right? I've got a great podcast about that coming up. And John, you really can't afford to become stagnant, right?
Yeah.
And
I mean, I think about where, the last few years have brought us. And I remember, sitting down out at Spirit Education years ago at a coffee shop with Wes, and we just were talking about, what's this whole thing going to mean for us, and it started pushing us in all these ways, toward trying to become the best we could be. It also caused us to think about where we were going to go and what we really wanted out of our practices, out of our lives. And I think COVID for all of us caused us to just pause and go, what is going on? What matters? Where do we want to be in 5 years, 10 years, 1 year? And you think about where life takes you from all of that. You think, you have to get to a place where you've got that balance. And I think if anything, millennials and younger have got a better grasp on that. And as we have kind of seen things over the last, 5 to 10 years, as we've been doing this show change, there's been some real positives from a personal standpoint. You see how priorities change. You see how life is shorter than you thought. And I think that is what COVID did for all of us. It definitely did that for Wes and I as we went through just thought process of where we want our lives to be in the coming years. And I think when it comes to dentistry, it changed our thought process on, you know, nothing changes as far as what you're wanting. In terms of your day to day, your wants don't change. But the things that you kind of maybe thought you needed when you were, starting off, maybe those needs change. The wants don't. And I think that's what I would get across to all of our listeners that have been with us from the beginning. And maybe if you're even new to this, is what I've learned over the last few years is your wants never change, but your needs might. Needs, things you thought you needed when you were 18 or 20 or 25 or whatever that age was, those things change. The things you thought you needed, turns out it's usually less than you thought you needed. The things you wanted when you were 18, 21, 25 as a new dentist, you wanted to be great at what you did. You wanted to do this, this, this. You wanted to accomplish this, this, this. Those things in general, wants don't change. So what we're here to do as we kind of kick off sort of the new era of the show is to talk a little bit about what have we been doing up until now? What have we been doing? And there have been some real, neither of us have stayed stagnant. We have spoken to major dental meetings over the last couple of years. And what we keep hearing is that people went into a world where they kind of stopped for a moment. They stopped going to continuing education, at least in person, because we kind of had to some extent. We kind of put our defensive shields on over our practices. And we sort of said, you know what? Let's just keep doing what we're doing as best we can because we're just trying to weather the storm. And it's crazy to think that was years ago now, but a lot of practices have stayed in that mode. Wes and I have time, I think, where we were kind of like, okay, let's get defensive because we don't know what's coming. But our last year has been very good, but different in what we have focused on. So, Wes, I want to kick it back to you. Let's talk about, first of all, what has been messing with you a little bit and what courses have been messing with you a little bit. And then we'll talk about maybe the last or the next couple of months where we're heading toward. But I'm interested because, for the first time in a while, Wes and I, because of our schedules, took different spear courses, which is weird.
Yeah, we just
Because
couldn't
normally
collaborate
we've
on
always
it.
been at all this. Maybe it just didn't work because of our timing. And Wes, you took one course. I'm about to take another. I'm very interested to hear about what's been messing with your practice, what's been messing with your mind, and what this last little bit of time has done as far as your practice and what continuing education courses are really changing the way you think about things.
Yeah, so the first thing that I would say is that this year coming, we are collaborating again, right, with the Academy of Osseointegration and John. It's in a big way, just like before.
Oh,
Okay?
yeah.
So what comes in this coming year, first of all, is a major get-together meeting that the Academy is putting together in Chicago on periimplantitis. And really, the interesting thing, before we talk about our collaboration with the Academy of Osseointegration, we love those people over there. It's one of our favorite implant journals. It's the #1 implant journal in the world, JOMI, right? And so what do we know about periimplantitis, right? Well, it turns out that we need to have a meeting, right, John, to discuss even how to treat it, okay?
Yep.
So here's what's been messing, right, with my mind. And John and I have talked about this from the very first episode, Tripod Implants, episode 1 of the Dental Guys, right?
Yep.
I mean, go back and listen to it because it's still valid, right? That we've got to know what we're doing when we put foreign bodies in people's mouths. And we know now that the American Academy of Periodontology ranks oral hygiene, how well people brush and floss their teeth, John, as the #1 risk factor for perimucositis and periimplantitis. Now, that's above smoking. That's above diabetes. And
that's controversial.
that's controversial.
I'm just going to say because AAP would want you to think that because that keeps people going to periodontist. However, I want to really dive in when we go out to the Academy of Osseointegration, which interestingly is in our sort of backyard in North Carolina, in Charlotte. And I'm very interested to talk to some of the best minds in implant dentistry about this and to say, okay, what is it about oral hygiene that is the major factor? Because we have been hearing so much, as you guys, if you've tuned into the show, about, is this a foreign body reaction? Is this a steady state between acceptance and rejection? What does this have to do with IL-1 polymorphism? That's right. We're bringing IL-1 polymorphism into the conversation. But how much of this is something that when you eliminate teeth, that it's no longer an issue? And how much of it is that people got there because they didn't brush their teeth and floss? And how much of it is the same patients who are prone to other pro-inflammatory diseases? Because I'm just going to say, Wes, I think it's a cop-out to say that because your oral hygiene is poor, that is a major risk factor. Because I'm just going to tell you, these people that got these implant restorations, they didn't get there because they were doing a great job. They got there because they were doing a poor job. And then all of a sudden, for most of them, we don't see progression. At least that's what I have seen. Now, I'm a huge believer in peer-reviewed data. And so if the peer-reviewed data convinces us that this is truly a patient effort issue, then I will throw up the white flag of surrender, and I will say, all right, the reason we're having problems with periimplantitis is because patients won't brush and floss. But I'm just saying that there were some real difficult publications about problems with implants with people without experience. And I will say, I worry that we are replacing a criticism of lack of experience in surgical knowledge and placement with a cop-out of poor hygiene to mask what really might be a problem of lack of understanding of placement and restorative acumen. Now, this is what we're going to be asking the most intelligent people who are much smarter than we are and much more well-read and actually doing the research. But I have a hard time with AAP on this. Now, I'm not saying AAP is a bad organization in general. They're the best nerds we got. And I like a nerd. And I feel like AAP brings the pain in terms of looking at data. And so maybe I'm wrong, and I hope I am, because I would love to be able to say, hey, use the water pick more,
right,
and we're not going to have problems.
Well, this is why we do this show, right? Because the hard questions no one really wants to ask. And what you've said here in a nutshell is that this is a multifactorial problem. And I am, as much as I am for the geeks over there at AAP, I'm also for the fact that I'm sitting here in a clinic, right, in East Tennessee, trying to mitigate issues that I'm seeing. And there's nobody, right, that can come to the table with definitive evidence right now that I'm seeing, right, that shows me a pathway. Now, I'm going to share with you right now, because this is the dental guys, my pathway for treating based on current literature.
I want to hear it.
Okay?
Bring it.
Because you haven't heard this, John. And this is a protocol I've been using over the past.
What I love about this is Wes. I get to hear from Wes. What are you doing in your practice? Right. And talk us through it.
You got to do something, John. Okay?
Yep.
So patient A walks in, right? You got two issues that could be the number one issue, right? The number one complication following implant therapy. Talk about single teeth right now. We're just going to focus on the number one thing is open contacts, right? Okay, so are you going to treat that, right? So here's my protocol, right? No matter what, the very first thing that a dental hygienist looks at is, does this patient have dental implants in their chart? Just like, do they have teeth, right? Is this an edentulous patient or do they have teeth, right? Okay, if they have teeth, then do they have implants? Then they look and physically see and ask, is there been any problems? If there's a food impaction, right, then that means the teeth have moved, the implants haven't. Okay? Teeth move, implants don't. The solution, right, is either to bond composite to the adjacent tooth or remove the crown and have the lab modify the implant crown. And then after that, deliver a night guard or some type of Essex retainer, okay, to maintain
so what your goal is with step one is to try to close contacts and then maintain a closed contact.
Right, and you're thinking, first thing you're thinking, guys, is like, who's paying for this, right? They're paying for it, right? Treatment plan.
Well, sure.
Composite treatment plan. Remove the crown. That's a code, right? I mean, you can go look it up yourself, right? Essex, yeah, they got to pay for that stuff, right? It's maintenance of a prosthetic, right?
Yep.
Number two, here's what we're getting into, right? The nitty gritty. Number two is soft tissue, right? Do you have a soft tissue issue, right, around your implants? Perimucositis.
attached tissue, or you're
Right,
talking
here we're
just
talking about a
perimucositis?
reversible, here's the definition from the Academy, right? A reversible inflammatory reaction confined to the soft tissue. We're not talking about threads. We're talking about around abutments. Any soft tissue that is reversible inflammatory reaction. Patient comes in for a
Essentially,
prophy.
this is the equivalent of gingivitis in the implant world.
Thank you, John. Right? And so we've got probing problems, right? We've got redness or bleeding upon probing. There's swelling present. There's definitely a problem. The appointment immediately converts from a 110 or a 4910, whichever it was, whether it's perio maintenance or prophy, to a 4346 or a 4346, scaling and replaning, to a 6081. Scaling and debridement in the presence of inflammation or mucositis of a single implant, including cleaning of implant surfaces without flap entry and closure. You cannot perform a 6081, which is what I just described, with a prophy or a perio maintenance or a 4346. That's great. Here's how you treat it. Number one, you identify the problem, you diagnose it. Number two, the appointment converts over to a procedure that costs and is productive for the hygienist, a 6081. You take off the restoration because you do screw retain, John, because we know that screw retain, and as we hope to interview our friend Chandra Wadwani, right? We take off the restoration. We scale and debride the site with an airflow. Yeah, EMS airflow, people, erythritol, right? And we clean the restoration, right? Now, currently, the literature says that dispensing minocycline around in mucositis will help to gain and not hurt possibly up to 1 millimeter of soft tissue. Now, this is all kind of out here, but this is the best we have right now. Okay, you place a healing.
Let me just real quick
recap.
So let me just real quick make sure I'm just recapping. So identify first if there's an open contact, right? If there's an open contact, we're going to restore that, whether it be adjacent tooth or modify the implant prosthetic to close the contact. Number one. Number two, provide some type of retainer or night guard to keep that tooth from moving again. Right. So that's a low hanging fruit.
That's the low hanging, but that's the most common, right?
That we don't, right? It is super common. So assuming that we still have mucositis, we still have a reversible situation, then your goal becomes, now we're going to potentially remove the restoration. We're going to debride the area manually as well as with airflow and erythritol. And then we're going to do what? Continue.
We're going to dispense minocycline, right?
Yep.
Some of you know it brand name Arestin. Okay. Place a healing abutment on the site. You're like, what? Yeah. Healing abutment goes on, right? Crown goes in your hand, folks. Stays in the office. Patient has to go home, just like for a perio check. We gotta observe healing. Okay, now keep in mind I've been doing this protocol for almost 2 years now. Okay, and what I found is what the literature said is that in 30 days we see resolution. Okay, just like you. Why? Why? I can't.
And I'm not saying I know all the answers. I'm not saying I
can't tell you. I can't tell you if it's the airflow. I can't
That's why we're
tell
going
you.
To the AO.
Right? This is why we're going to the AO. I can't tell you if it's Arestin, but what I'm seeing is that patients are returning and they're getting better. And if the patient has an anterior restoration, right, you're thinking, well, what about in the anterior? Yeah, we put the restoration back on, guys. I mean, we put the restoration back on because, collapse of soft tissue and all that. We do have to follow up with these patients at 3, 6, and 9 month intervals, right, just like with perio maintenance. But that next visit, that converts into the standard prophy, the standard reeval recheck. It either goes into a perio maintenance, so it's still very productive. Mm-hmm. It's a very business-driven plan as well.
So my questions with this, which I like it because I like the idea of saying you're trying to do this scientifically. You're trying to do variable by variable removal here of, all right, let's eliminate a contact problem because that's easy, right? We
Yeah.
can see it. We know it's a potential problem. Maybe this is just a food impaction problem, right? So we eliminate that variable. Easy. Number two, that variable has been eliminated. We know it's not food impaction. We know there's either an issue with, I'm simplifying, the implant, right? The restoration, patient hygiene factors, or the patient's own genetics, right? I mean, there's not a lot more than I can think of.
I mean,
It's
you're
either
killing
the
bacteria.
implant is a problem. You're right. The implant's a problem. The restoration's a problem. The hygiene's a problem, or the patient's a problem. We don't know yet which one is the problem, but we know it's one of those few. So at this point, we say we're going to go ahead and we're going to eliminate the restoration. You're saying we're going to take it off. We're going to debride the area the best we can. And now comes all the questions.
Yeah.
Why did they get better or not, right? If they don't get better, what is your plan? That's my question first, is if they don't get better, what is your plan? What are you going to do next? If they get better, I get it. You're putting the restoration back on. You're maybe chalking it up to either hygiene problem, or maybe you're still thinking could be restoration, but you're putting it back on. But what happens if they don't get better after the healing abutment? Because it seems to me like that is where you got to make some decisions. Like, what do you do next in those cases?
Yeah, I think this is the questions for the Academy, and this consensus statement that we're really looking for is, this is the best evidence we have, right, to perform this this protocol. There's more to the protocol. We can dive into the nitty-gritty. We're not doing that on this podcast, but we're just going to pose some questions to the Academy at this point, is like, we need more direction. Now, the minute, John, that this turns from perimucositis into periimplantitis, where I have threads involved, supra bony threads, right? Now, don't think that, I'm never going to see that, right? Even with the most modern protocols. And John, I agree, right, that there could be an issue with our surgical training, right, that we're seeing amongst some factions and dentists that I don't know. I mean, there could be, right? We got to be careful surgically to make sure we're doing the right thing and we're choosing the right things and how we do surgery. But we will see, you will see, right? I have been seeing, right, thread exposures, whether it was my implants, whether it was someone else's implants that were put in years ago or last year, or patients that show up in. But what do you do with thread exposure, right?
Ooh.
So according
this
is a whole thing, but
conversation.
Who's treating that? If you're in a rural area, you need to have training, right? Because we're talking about, right, and I want to, because Dennis Tarnow has published some stuff in Compendium recently, right, on polishing implants and how to do this to get a polished surface, right, which we know polished surfaces do well in soft tissue, right? Polished titanium, removing the roughened surface, removing nooks and crannies, essentially, removing the bacteria like intricacies that were supposed to be in bone but now are above bone, to get rid of the inflammation, right, in the epithelium. So, listen, we need answers, right? So this is here's, John, you asked me, what's
the stuff that's messing with you?
Messing with me, right? Now, we're going to get into some other things in the rest of the show that have been messing with me, but John, I think that what we're saying here is that we're going to be going to the Academy of Osseointegration. We're going to be hosting speakers live on the show floor, recording interviews just like before. John, tell us a little bit about who's going to be there and some of the potential people we're going to be interviewing.
Yeah, well, I mean, when we talked about this meeting, right, a couple of years ago, and it was a weird year because, again, we talked about this at the beginning of the show. COVID messed with us. it made us kind of start to rethink how education looks. And we were speaking at the AO in that year and talking about how live education, in-person education, that there's no replacement for that. So now here we are, fast forward a couple of years, we're going to be in 2024 in Charlotte talking to the best and the brightest, right? So who's going to be at AO in 24 with a focus somewhat on periimplantitis and what we're doing to try to push that science forward. So here's just a little preview of some of the people that will be available potentially to you to hear on our show. Stephen Chu, we've been working on this guy a long time, one of our favorites. He's going to be speaking there.
So elusive.
Yeah, elusive is a good word for Stephen Chu, but not this time. We feel like we have our sights set on him. We're going to be talking to him about what have we learned about dual zone concept and how is that really affecting how we think about our implants from a standpoint of start to finish.
I mean, who is Stephen Chu to even begin with, right? I mean, like some of you listen to this show, right? I mean, like you may not know, but here's a guy, right, that a prosthodontist that works with side by side with one of the greatest periodontists of all times, Dennis Tarnow. And we're going to talk to him about how to manage soft tissue during the graft, during the immediate placement.
Provisionalization. Yes. And what do we do and how far can we push immediate provisionalization in the anterior region, in the immediate implant, and what are we seeing as a result? Are the days of extraction, cover screw, soft tissue grafting times 3, bone grafting times 7, patients has no tooth for a year and a half, 2-3 years because we're trying to get this. Can we just preserve what we had? Or is that pushing it too far? So that's what we want to ask Stephen Chu in combination with Dennis Tarnow. Another very interesting gentleman that will be around is Istvan Urban. We have talked about Istvan because he seems to have either special sauce, Miracle Grow. We talked about BMP 2 years ago as Miracle Grow for bone. Turns out that wasn't true. But does Istvan Urban have big oops. Does Istvan Urban have the Miracle Grow for bone? And is it actually technique? Is it material? Is it something that he has that's special, or can we all achieve the type of results he's getting, for instance, in the posterior mandible? He will be with us. Michael Norton always brings the pain, always brings the good stuff. We're hoping he can inspire us with a few more, interesting ideas, potentially things that make us think differently.
You know what I
will never forget. Yeah, go for it.
Is the fact that this year the Academy, right, is allowing us to interview key opinion leaders from manufacturers. And Michael Norton.
Oh, I'm so ready.
Dude, good morning, Astra.
That's right.
Remember the days? Right? This old Academy, like pre-meeting meetings, right? Corporate forums, they still have them. Good morning, AstraTech.
Right.
With
Back
Michael
when
Norton.
Companies would make statements that would then be challenged in the audience by scientists who would say, that's not true, or how many cases do you have? Because that's what AO is all about, is challenging whether what you're saying is marketing or science. And Michael Norton's been around long enough to have seen it all.
Yeah.
We also have some real high-level scientists that are going to potentially be able to speak with us. Hamle Wang, probably one of the best, if not the best, or the most well-read or most well-published on periimplantitis.
Yeah.
Able to probably speak to any potential questions we have on how to currently treat periimplantitis. We've got Todd Schoenbaum, not been there that I've seen before, from UCLA, director of the Aesthetics Center there, has published some articles that we commonly refer to as we're teaching about how we deal with provisionalization, how far can we push it. He's going to be there. Of course, Craig Mish. We've got Sonia Lazy. We're hoping we can get Sonia on the show because she has been an excellent voice with Braun Miller.
Surgery's
for how
not done.
Things should be done.
Right. Surgery's not done. Remember when she said this?
Yes. Oh yes.
Until the restoration, right? Or the provisional or the custom tissue former is in place.
Yep.
Some of you
Love
want to
it.
disconnect surgery from the prosthetics. Not Sonia, right?
Yep.
She knows
She's
it's
able
integral.
to bring that together. Having, two people practicing very similar, that from what I can tell, to Tarnow and Chu, coming out of Canada with the ability to understand how the prosthetics and the surgery play on each other. These are just a bit of a preview of some of the people we hope to bring to you guys and girls on the show in the coming months. And I think, as we talk about, Wes, what you're doing with periimplantitis, and we talk about what's messing with you, and I think these are the kind of conversations that a lot of people are having right now, as we are seeing more and more that the further we go on in our practices, the more we're dealing with, previously placed implants that were placed by potentially folks that may not have had as much training or experience, or maybe they did. And we're now having to deal with the long term. This is what the AO is going to be
Listen, you
focused
can
on.
catch us at the annual meeting, March the 7th through 9th, okay? I don't think, maybe yes, it is January, right, John, 2024. Happy New Year, right? If you're listening to this, right? It's crazy. 2024 is here. If registration is open, we want you guys to head over to osseo.org and register now to the 2024 meeting. It's in Charlotte, North Carolina. So if you live in the Arctic tundra, you can come down and thaw out for a little bit. It's not going to be too hot, not going to be too cold. It's just going to be right. Charlotte, North Carolina, March 7th through the 9th. The dental guys will be there. Come say hi, right? And we will be recording. We'll be in some of the meetings. We'll be around and about. Come say hi, get a photo opportunity with maybe some special people, right? Some of the dental giants. We're super excited about that. Now, John, I know that things get real serious when we start talking about how important it is that we are breathing and sleeping correctly. John and I were successful in implementing parts and pieces of airway diagnosis, at least into our practice, and have really broken into a next level collaboration, right, with very high level people. And this year's kind of special, John, because we have really begin to talk about what we're collaborating on with some of our favorite people in Scottsdale, Spear Education. But John, when it comes to sleep, we just keep hearing it time and time again. It's not a fad, John, right? It's not a fad in children. It's not a fad in adults. Breathing and sleeping is one of the key components to decreasing your chance of developing neurological problems. If you want to move the needle, right, move the needle on cardiovascular issues, right, which is very difficult to do, right, you need to sleep more. You need to breathe better, right? Now, we could talk about other things that can impact that. If you want to move the needle neurologically, right, on Parkinson's disease, the incidence of dementia, right, Alzheimer's, right? Let's talk about breathing and sleeping more and not missing out on 10-year chunks. Now, John, this hit home for you, right? And I want you to give us a little teaser, right, of what's been messing and how bad it messed with you and how far you've went.
Yeah. I think airway and wear and breathing started messing with both you and I when we took the Warren Dentition workshop at Spear. And I mean, it had been talking to us previous to that, but I think it got us thinking, everyone needs to be filtered through the lens of, could this be an airway problem? And it might not be. And I remember starting off thinking, I just don't want people to break my stuff. Why are these people breaking my stuff? I don't want that. I don't want people to break my stuff. I want to fix them and be done. And I don't want them to break my stuff. And as I went out there, hoping to just be able to put my head in the sand and just have some straightforward fix of some, miracle of occlusion, it turned out that airway really was a compelling scientifically reason for why people are breaking our stuff. And as I started getting into that, I started seeing what was happening in our pediatric patients, our adult patients with airway, and why it was the potential problem of why people are breaking stuff and why people can't breathe and can't sleep. And I will save the majority of it for another show because there's a whole conversation. But I will say that in my own life, I remember Jeff Rouse saying, find your Jake, find your person in your life that you might have missed that has an airway problem. And I remember as, I kind of was digesting all of this and starting to implement it in my own practice. And then all of a sudden I saw it in my own wife, that she was exhibiting some of the same issues that I had been learning about. And so, long story short, and we will cover this in great detail as we go forward, but my own wife ended up having upper airway resistance syndrome diagnosed.
Well, John, that's not a diagnosis.
Right.
That's
yeah,
not
exactly.
even a current diagnosis. You can't say that.
Right. Identified through the smartest people that we got in the country, maybe the world. And, once it started messing with me, I couldn't have it stop messing with me until I knew what it was. But when you don't dream and you don't get into deep sleep and REM sleep, and you start to see some things happening, and once your only solution starts to become surgical after you've done everything you can to try to do it non-surgically, and then when you have to tell your own wife, it might take surgery if you want to be fixed.
Wow.
And, when you like your wife and you don't want to be, punched in the face, and, you want to actually, have her be a happy person, and you have to have those difficult conversations. And tonight, this very night before I got on the show, I went down into our bedroom and I IPR'd my wife's teeth.
Showstopper. I went into my wife's bedroom and I IPR'd her teeth.
Yeah, dude.
This is the dental guys. You guys have missed
millimeters.
this.
0.1 millimeters.
I don't think that's the best ever statement you've ever made.
At the request of Rebecca Bacau, who is doing her treatment planning and orthodontics in Seattle after her having a modified dome procedure, a rapid palatal expansion, orthodontics to keep the diastema closed,
and did it in clear aligner therapy, John.
Yeah,
right?
Now we're in Invisalign to close the space, and now, 53 minutes ago, I did 0.4 millimeters of IPR because she's got a slight black triangle between 9 and 10 and 5 more aligners to hopefully finish her case up. Yeah. I'm a believer, Wes.
Lay down, honey. It's time for your IPR.
That's right. I'm a believer, and she is too. As hard as it has been, it's a game changer. It's a life changer. It's a change in not just a way of thinking, but in a way of how a person feels and lives their life.
So I think that this is the thing.
A believer.
This is the thing, right? We, John and I, believe in this so much, right, that we're willing to put our dearest loved ones, right, in the position to
not afraid.
We're not afraid, right? And I think that in the future shows coming up, we're going to have an opportunity to sit down with some of these people that have been through these things, right? And talk to them, right, about what they've been through and what they were before and what they are now. Because I think that the hardest thing in this is learning how to move from stabilization, or can you get to stabilization, one, and if you do stabilize, can you move from a stabilized situation to something that is remedied through these, and most of the time it's surgical and orthodontic, right?
Mm-hmm.
And it means that you're probably going to be not near someone that is doing this. Most of my patients are leaving my town to have these things done, right? I mean, John, your own wife went across the country to have these things done in a whole nother city.
Not because we don't want them to be done here, but because it is extremely difficult to take the information that you have learned. And so this is why the dental guys exist, right? It's to take people from all levels, right? It might be the first time you've ever heard about it. I don't care. I was that guy a few years ago. I was completely oblivious. And now you start to talk about it. You start to read about it. You go to courses. You see it. And then eventually, if you see how it's affecting people, maybe it becomes a part of even your own life.
Yeah.
And that's what the Dental Guys is all about. It's taking it to the next level. And I think that as we talk through these next few episodes about what's been messing with us, because Wes, I want to hear all about what's been messing with you. And I think in the next episode, kind of one of our big focuses for you all is going to be talking about some of what Spear Education has been messing with us about in this last year, and how it's affecting our practice, and me certainly for some of the airway side, as well as some of the crazy, implant cases that we're seeing. Wes from some really advanced composite work he's been learning about and doing. We all remember that composite is still one of the most difficult things we ever do. And I think that down the road, like Wes said, our thought is to have some of the people that have been the most affected by some of these really complicated airway cases, whether it be the treating surgeons, orthodontists, and even patients, to be able to talk to you about what their life looked like before and what their life looks like after, and to really be able to pass on some of the passion of what these last few years. If you've been listening to our show, you know this is not new information. If you've been following along, you know that all that we are talking about are things that have been set up over the last few years of our journey. So I want to kind of just give you this preview of where we're going. We have some things that are just set up in the next few weeks, January, February, into March, through the AO. It's going to be a wild, wild time, Wes. And then through the rest of the year, we have got the potential of having some of our favorite Spear Education guests on, some of our favorite AO guests on, to talk about what's the best, what's new, what's messing with them. So I really just am excited about where we're at. It's taking everything we know, and now it's trying to put it all together in a brand new way, and maybe deconstructing it if we have to. So Wes, I mean, we're ready for that.
Yeah, so I think, if you're listening to this and you're thinking about, man, the dental guys are back. They're still friends. They still have each other on their cell phone, right? I mean, guys, John and Wes are back in a big way, next level ways, right? And more of the same, more of taking complex things and breaking them down into the simple, taking the day in and day out dentistry, right? Composite bonding. Hey, next episode, see what's changed with composites in my practice. It'll blow your mind. Some simple steps you can do right now, right out of dental school. Or, hey, if you're struggling with just the standard stuff, how much do I bevel? Hey, I'm going to talk about that and what I've learned. And it's going to be amazing. So if you're here, follow us on YouTube, follow us on Instagram, follow us on Facebook, all those things. We're super excited about what's to come. And for John, I'm Wes, and we are the Dental Guys.